Afternoon, everyone. Welcome to our question and answer session that we are doing with the media, but also live stream so that you can be up to date on what's happening with COVID-19 in Eau Claire and what's happening across the state. We are having our new day today on Thursdays, our Q&A session with media. We moved that from Wednesdays so that we would have more up-to-date information for all of you on our measures and our order as we have moved those dates as well. So thanks for joining us. Today, like usual, we'll go through some state data. We'll talk about the Eau Claire County data, and then I'll touch base on a couple of updates that we want to make sure everybody hears about. We'll also answer the questions that came in advance from the media, and then any additional questions that media may have for us as we go through the discussion today. So a couple of quick updates from the state. The total negative counts for tests for COVID-19 now are at 1,304,724, over 9,000 tests, negative tests since Tuesday. The total positive count for COVID positive individuals in Wisconsin is now at 94,746. 2,034 individuals were identified as COVID positive individuals in a one-day highest single day amount since Tuesday. The total ever hospitalized is now at 6,522. And we now have 1,231 Wisconsinites that have died from COVID-19, an increase of 3 people. Across the state, obviously, hearing those disease counts, the cases have been increasing at one of the fastest rates since the beginning of the pandemic. In some ways, we are anticipating this across the state with the start of school, both K-12 schools as well as our higher ed institutions. And we know that people are gathering more frequently. So certainly as we work to slow the spread and slow the number of people that is a close contact to any individual case and the number of people that get COVID-19 from a positive case, we're challenged the higher those numbers go. We do know from the state data that we've had a high increase in 18 to 24-year-old age group, and that's certainly been reported on in other locations. What is good news, though, is that in that age group, many people are having a low level of symptoms. The hospitalization rates are not high, and that is a positive outcome. We do know that young people can be hospitalized and have been in the state, and we know that young people can also die of this disease. More importantly, our young people are people that are out in the community. They are socializing, they are interacting with multiple generations, grandparents, parents, and younger siblings. They are also in internships and in jobs where they may come in contact with very many high-risk individuals. So it's important that we pay attention to all age groups as they are having COVID-19, because there are really challenges across the board with our population. The state 7-day average is now, that positivity rate is at 14.3%. Certainly an increasing positivity rate and one that is higher than what we would like it to be. In Eau Claire, our data shows that we have now done 20,641 negative tests for COVID-19, an increase of 1,473 since last week, Wednesday, when we last spoke with you. Positive tests for COVID-19 individuals, so these are not positive tests, but people in Eau Claire County that have had a diagnosis of COVID-19 is now at 1,336, an increase of 361 individuals since we last reported to you. Remember that our goal, we've talked about before, and national models show that for our population size, that we should be targeting to be at about 10 cases a day, certainly less than 25 a day. And we are way outside that range right now. As we talked about last week, our case numbers are increasing rapidly, and we'll talk about some of those metrics later on. We have had the highest single week 7-day caseload to date this week. Our positivity rate for Eau Claire for 7 days is now at 18%. Of our cases, 1,105 have met the definition for recovered. That means that we are working with over 290 Eau Claire County residents who need to remain isolated and their close contacts who need to remain quarantined. Of our positive cases of COVID-19, 45 have been hospitalized at some point during their diagnosis, and we have 6 individuals that have died. Again, very positive in this community that our hospitalization numbers remain low, and our deaths from COVID-19, while every one of them is very difficult for the families involved. Every one of those hospitalizations is hard, but as we can work hard to keep those numbers low, that is our continuing goal. Every week, the State Health Department, DHS, lists the active investigations, and we are now listed as having 16 active investigations. That is through Sunday, the 13th at 9 p.m. Of those active investigations, the majority are in long-term care facility settings. Again, those facilities are doing regular testing of their employees. It's a good thing that they are doing that testing and finding those cases of COVID-19 that we know exist in the community. This doesn't mean that there is something wrong happening at our long-term care facilities. It does mean they're testing, and we know that there are COVID positive people in our community that may not be tested. We need to know about people working in high-risk settings, and we need to make sure that those individuals are isolated so we don't have spread to our most vulnerable populations. Public health investigations are also happening in educational facilities and workplaces and in other settings across the community. The state rating for COVID-19 activity level remains high, and most of the counties across the state are at that high activity level. Once a week, we report on jail testing data. We'll start doing that on Thursdays now that we are talking with you once a week. And we're not doing our Monday briefings where we previously were reporting jail numbers. As of September 14th, 135 individuals connected with the jail in Eau Claire were tested. 8 were found to be positive, and all 8 of those individuals are recovered. We do want to talk a little bit about schools. We know that the school setting is a place where people are concerned and frustrated, both. And I want to walk through a couple of different pieces of the school situation in Eau Claire County, and we know we have a few questions related to that as well. We know that, and we knew starting schools back at the end of August, that there would be challenges with bringing large groups of people together, both K-12 education as well as higher education. And we have a lot of people in our community that have some connection to our educational systems, whether they work in those systems, they have family members in those systems, or they count on those systems for students that are working in their businesses. So there's a lot of connections in this community to education. A couple of things for you to know. First of all, our goal in all of our educational sessions is as much as possible to have students not miss class time at whatever grade level they are. We in the health department and across this community prioritize education. It's a critical part of what we do for young people to be successful. And even in times where we're concerned about a pandemic, that needs to remain a priority. I give really enormous credit to our educational leaders across all systems for the hard work that they've been doing all summer and as school has started to really find creative ways to continue to have school happen. I give them that credit, and I know it's been enormously difficult. In order to slow the spread of disease in these settings, that 6-foot distance and keeping people home when they are sick or when they are potentially exposed to COVID-19 and potentially going to become positive, we need to make sure that we have strategies that are in place to slow the spread of disease in those settings. That 6-foot distance makes an enormous difference. And keeping people that are ill home and keeping close contacts who may become ill home will help make sure that we keep our schools operating in the most effective ways possible. Again, if we can keep people 6 feet apart in our educational settings, it'll lessen the likelihood that a large number of people will have to quarantine. We've seen school settings across the state of Wisconsin and across the nation that have had to close simply because all of the students in a classroom had to quarantine, or all of the teachers had to stay home, and they couldn't have school happen. And we don't want that to happen in Eau Claire. We really are pushing hard that if people maintain 6 feet and do those things that keep disease as minimal as possible in the school setting, we're more likely to keep more kids in school and more teachers in school. And that's really our goal. Contact tracing within schools is an enormous priority. We have had positive cases of COVID-19 in all of our educational systems. So K-12, UW Eau Claire, CVTC, all of our educational systems have had COVID positive individuals, and that's to be expected at this point. When someone does test positive, we're prioritizing the work that we do to identify close contacts, especially close contacts that either live or learn in settings where they may expose others. So schools are an important connection for all of us. We work closely with the school where there is a COVID positive individual to identify close contacts and follow up with those individuals within that setting. Please know that if there's a high-risk exposure, if there's a close contact exposure in an academic setting, those that are impacted by that close exposure are contacted. It may be by the health department, we hope it is, but when we are overwhelmed with our case numbers, we do have sometimes the school contact the individual families themselves. If you get that phone call that says that your child or you as an individual were a close contact to a COVID positive person, we expect you to quarantine. We know that you want to make sure that you're not spreading disease to others, and this is our best way to make sure that that doesn't happen. If we can slow the spread by really getting those close contacts to stay home for 14 days, we are much more likely to not have that next ring of infection happening. It's hard to be quarantined for 14 days. It's hard to miss our activities. We need to count on people doing that. We need you to make a plan now to expect at some point to be a close contact of someone that is COVID-19 positive. Make a plan for how you would handle that and what you would do. Please know that we understand it's hard and we have shared interest in keeping the spread of disease as slow as possible. And this is one concrete way to do it. We've also said from the beginning, and we continue to honor, that every school needs to work through how they are planning for education to happen within their school setting. We work with every school to give them the tools they need to make decisions about slowing the spread of communicable disease, but the school is the best place to make a decision about how to operate given that guidance. Some schools are able, because of their space, to have 5-day-a-week in-person classes, or to have all of their classes, if they're a higher ed setting, happen in person, and some are not because of space requirements and other requirements. There are challenges and opportunities in every one of the models of education that people are using across the nation. Do know that in school districts where there are higher numbers of students, so in Wisconsin, the top 10 school districts from a size perspective, Eau Claire Area School District is one of those top 10 schools for size. In-person education fully is only happening in one of those school districts across the state. All the rest are either hybrid model like we have at the Eau Claire Area School District, or entirely virtual. Every day I'm on the phone with my health department colleagues across the state, and many, many, many areas of the state are moving to all virtual education because they have not maintained the 6 feet distance in classrooms, and because they have many, many children that are COVID positive or close contacts of those that are COVID positive. We continue to have the goal to make it as possible as we can for kids to be in school. And we really share that goal with all of you in the community, and we support schools and how they are making that happen. Some success with that. To date, we have had very, very few cases of close contacts within a school setting, whether it's K-12, CVTC, or UW Eau Claire. That's good news. That means we're doing some things right to slow the spread and take care of each other. And I'm really impressed with the hard work that's happening to make that happen. Knowing about close contacts is critical, so we continue to ask all of you that if you become COVID positive, if you're diagnosed with COVID-19, that you work with the person that calls you from the health department to identify all your close contacts. It doesn't do any of us any good if you don't tell us who you've been in close contact with, as difficult as that may be. If we can identify those close contacts and keep the number small that spread from there, the better off we will all be. We have a long way to go this school year. It'll continue to take a healthy and supportive community to make this successful. So really find ways to support your school, to support the decisions that they are making, and to work together to make sure that we can slow spread in our community through our interactions in school. A couple of other updates about our metrics. Every week, we update the measures that we are using to evaluate how we're doing in this community related to COVID-19. They're connected to our order and they're connected to our long-term planning. I'll share some of those metrics with you, but you can certainly look on our website where they are also posted. Our case count over the past 14 days is now at 498. It's our highest 14-day case count to date since the start of the pandemic. We often get asked about the numbers affiliated with UW Eau Claire. People know that our highest group of cases is in that age group. Do know that that is our largest proportion of cases is in the age group that is young adults. About 45% of all of our cases since September 1st have been affiliated with UW Eau Claire. The rest, 55% of the cases, were community members that were not UW Eau Claire affiliated. We continue to work with UW Eau Claire on data. It's important to us as it is important to them to understand how UW Eau Claire impacts our case numbers. The vast majority of the cases connected to UW Eau Claire have been off-campus living students. Statewide and locally, we're seeing that 20 to 29-year-old age group is the largest age group. It's a higher percentage of cases compared to the other age groups, as I shared earlier. In Eau Claire, that's been true for several weeks and was certainly true even at the beginning of the pandemic. Many of those people in that 20 to 29-year-old age group are college students, but many are not. And I think we need to remember as a community that young adults are typically a social group. They are engaging in activities where they live together and they socialize together in ways that, because of the way this disease spreads, will spread disease more rapidly. We want to remind everyone, though, that people that are in close contact and are engaging in social and work activities that are in close contact will be more likely to spread disease. Age is not independently a factor. It's really the behavior that is the issue. We also know that, that this is something that we need to pay attention to as we have young people working and interacting in the community. So important to note. A couple of other measures that we track every week. We do have now 11 new outbreaks in the past 2 weeks. That indicator is in red, as are the previous indicators indicated. The total case counts over 14 days. Community spread is about 35% of our cases. Again, this remains in the red. And our positivity rate now for Eau Claire County is at 14.2% as we calculate it using the state data. That is also in the red this week. 86% of our cases, people identified with COVID-19, are reached within the first 24 hours. That is in the yellow. But unfortunately, our contacts of cases are now at 36% in the first 48 hours. This is important for people to understand that as our case numbers go up, we are not as quickly getting to the close contacts. We are asking cases to let their close contacts know to quarantine. And we are calling, the health department is calling those really high risk close contacts to make sure they are quarantining. We're counting on community members understanding that if you are a close contact to a COVID positive case, you are needing to stay home for 14 days, home from work, home from social activities, home from school, all of those things. You need to stay home and not spread disease, and get tested during that time to see if you are COVID positive during that 14-day period. If your friend or coworker tells you that they're COVID positive, listen to them. If you have questions, you can call us and we will talk and walk you through that. But it's important to remember that all of us will slow the spread of disease if we follow those public health best practices to quarantine if we are a close contact. Every 2 weeks, we also talk through our public health order. The new public health order has been renewed again for an additional 2 weeks based on the data that we are seeing. Again, that data has increased rapidly and remained high, not just because of the start of our higher education institutions, but because we're seeing disease across the community. No changes were made to tighten the order to make it more restrictive, despite the fact that we have many indicators in the red. Again, those gatherings of 100 or less indoors, 250 or less outdoors are mandated to be at those levels. We recommend that outdoor and indoor gatherings be no larger than really a small group of people that you know well. There's an additional item of language in the order that really strongly recommends our institutions to really think about prohibiting activities that by their very nature may encourage people to be in closer contact. Again, the requirement is to maintain 6 feet, but there are some things that just by their nature may be more difficult to do if we have that 6 feet in place. So really strongly encouraging people to think through those high-risk situations and make decisions about whether or not to make them something that we just don't do for a little while in this community. I'll walk through some of the questions that we received in advance, and then certainly we'll open it up to those of you that may have questions that are online that are media. Janessa is here today to help me with those questions as we get them. So I'll start with the first question, which is, we've heard that at other UW system campuses, students who are given both a PCR and an antigen test and test positive in both are counted as 2 cases. Would we count them in the same way in Eau Claire? And how can we talk about how we count cases? So PCR and antigen testing are 2 different ways to test for COVID-19 presence, active COVID-19 disease. Our campus, like many campuses, I believe all of the UW campuses, are using both testing strategies to identify people that are COVID positive. UW campuses have different ways of reporting the testing that they are doing. Some of them are reporting the number of antigen tests they do and how many of those are positive, and the number of PCR tests that they do and the number of those that are positive. The state numbers and the numbers that I share with you and that are on our website are by person. So anybody that tests positive is 1 case. So even if they have had multiple tests done, with multiple testing types, if they've tested positive, they are counted once in the data system at the state level and the data system that we use locally. So again, there may be different ways that UW system are showing the number of cases that they identify via an antigen testing system or a PCR, but the individual themselves is only counted positive once. at Eau Claire know that anybody that has received a positive antigen test is sent for a PCR test. And again, that one individual, if they have both a positive antigen and a positive PCR, is considered one case of COVID-19. We also have a question related to a visit by the Vice President, Mike Pence, next week in Eau Claire, which we are hearing about. And the question is really asking about large crowd gatherings, people not wearing masks or things of that sort. Again, I have very limited information about the vice presidential visit next week. That's certainly not something that the health department is actively engaged in. As we get questions about any large gatherings, whether it's something like this or any other type of large gathering being proposed, our recommendations are the same: 6 feet distance, wear a face mask as required by state law, and make sure that anybody that is symptomatic is staying home. So our recommendations are the same for all types of gatherings. We also have a question about other UW campuses that have gone into lockdowns or sheltering in place or other strategies that they are using to potentially slow the spread of COVID-19. The question is, has the health department advised UW Eau Claire to take similar measures? And if not, does the health department have a metric for when that type of action should happen? We are in conversation every day with UW Eau Claire, and we are working very closely in partnership with them. We have not made any recommendation to them specifically around a strategy as asked in the question about lockdown or sheltering. And we don't have a single metric that would push us to that point. It's really a balance of looking at multiple measures and multiple strategies to keep students, faculty, and the community as safe as possible from this communicable disease. We are working really closely with UW Eau Claire, and we will continue to work closely with them as decisions are made over the course of the next semester and next year. Ultimately, UW Eau Claire is the decider about how they plan to do education as they move forward. We finally have a question in advance about whether the health department is planning to make recommendations or have any rules related to trick-or-treating with Halloween coming up in Eau Claire County, or is that ultimately a decision by someone else? We have started to get this question, as have most local health departments across the state. The state health department is coming out with guidance. We believe it may be as soon as later today or tomorrow. Once we get that guidance, we'll be sharing that broadly. Certainly, our recommendations to anybody that's planning a family trick-or-treat event or a community trick-or-treating event is to really follow the basic principles again. The basic risk factors continue to be there, which are keep 6 feet distance, stay with a small group that you know, make sure that you're wearing a cloth face covering, and perhaps you can find creative ways to make a cloth face covering part of your costume this year. And really make sure that anybody that is not feeling well is staying home if they're sick. It's hard to miss special events, but it's even more difficult if during those events we expose others. We over and over and over again have shared with you and will continue to share with you that the spread of COVID-19 often is in those settings where, again, people are going to birthday parties, going to family gatherings, to reunions or other events where someone afterwards realizes, yeah, I didn't feel quite well, and they've spread COVID-19 to others in those settings. We just have to be really vigilant about making sure that if we're not feeling good this year, we decide to stay home and make sure that we're not potentially spreading COVID-19 to others. I really want to say that we have a great community. We're working well and finding ways to support one another, and I'm really counting that we continue to do that we continue to encourage each other and finding healthy ways to be interacting and creatively healthy ways to be interacting. I see it every day, and I hope to keep seeing that as we go forward in the fall. So, Janessa, do we have any questions? No. Does anybody want to unmute in the media and ask a question that they haven't typed into their chat box in advance?
Hi, Lisa. Thanks so much for your time. Question I had regarding the health ordinance that was introduced earlier this week. We've had a few people reach out to us, and so I wanted to pass a question along, wondering why an ordinance like this is necessary in Eau Claire County when, because a lot of the understanding has been, this ordinance kind of outlines the process for issuing orders and things of that nature moving forward. We've had several different health orders now in Eau Claire County, and it's our understanding that you have that authority from the state of Wisconsin. So why is this local ordinance a necessity?
Thanks for that question. So the question is related to the local ordinance that's been proposed by the city of Eau Claire and Eau Claire County, related to how general orders in a communicable disease situation would be framed, what the guardrails to that ordinance, what the legislative oversight of that kind of order would be, what the procedural and substance safeguards would be in an order like that, and what the citation authority would be in an order like that. The questions that have bubbled up as we've done these local orders have really primarily been around citation authority. We do have authority to have these orders at a state level. The state statute gives us that authority. We in May did pass a county ordinance that really talks about citation authority. These ordinances strengthen that a bit. They give specific ability within the city of Eau Claire and across Eau Claire County to cite if there are examples of an order being violated. These ordinances, though, are not specific to COVID-19, just to be clear, and they are not giving any additional authority beyond the ability to write citations to a local health officer that isn't already present in state statute. State statute does give the ability to write these local orders. Looks like there might be a question in chat. Is that correct, Janessa, or not? No? Okay. Good. Well, again, thank you, everybody, for joining us. We do want good information to be shared across the community about COVID-19. We'll be back. Again, we're now on this once a week schedule, so we'll be back on Thursday to update you again with our local data and what is happening in the community. If there are questions that can't be answered on our website, the COVID-19 eauclaire.org website, please do call the call center. That number is 715-831-7425. And again, my enormous thanks to everything everybody is doing in this community to stay healthy, both individually and as a community. Thanks.